हाम्रो गाउँघरमा धेरैजनालाई क्वेसन आइरहने विषय पब्लिक हेल्थ। पब्लिक हेल्थ भन्नाले 2-3 तरिकाले बुझ्न सकेला। एउटा कुरा भनेको समाजमा कस्ता खालका जनचेतना फैलाउन लागि, कस्ता खालका स्वास्थ्य सम्बन्धी जनचेतना फैलाउनका लागि आवश्यक छ र यस्ता जनचेतनाका कामहरू कहाँ, कसरी कसरी कसले गर्नुपर्छ भन्ने कुराको भागीदारी लिएर बस्नु नै पब्लिक हेल्थ अफिसियल्स हुनुहुन्छ। पब्लिक हेल्थ लिएजन भनेर कोलम्बस पब्लिक हेल्थमा उहाँ आज मसँग भलाकुसारी गर्न आउनुभएको छ। अगर तपाईँ कसैलाई पनि पब्लिक हेल्थ सम्बन्धी केही प्रश्न छन् भने तपाईँले प्रश्न राख्नुहोला। कोलम्बस पब्लिक हेल्थ भनेको कोलम्बस रिजनको सेन्ट्रल ओहायोको सबैभन्दा ठुलो एउटा पब्लिक हेल्थ सिस्टम हो, जसबाट चाहिँ कोलम्बसमा बस्ने, कोलम्बस त के कोलम्बस वरिपरि बस्ने सबै सहरका मान्छेहरूलाई त्यहाँबाट नै यस्ता खालका जागरणका काम र अरू धेरैवटा कामहरू त्यहाँबाट हुने गर्छन्। र आज मसँग हुनुहुन्छ जिन बेली। म उहाँको परिचय पढेर सुनाउँछु, छोटो परिचय अलिकति पढेर सुनाउँछु, त्यस पछाडि उहाँसँग बसेर हामी भलाकुसारी गर्छौँ। उहाँको परिचय चाहिँ अङ्ग्रेजीमै पढेर सुनाउँछु है त, तपाईँले पनि सुनिदिनु होला। जिन बेली इज ए डेडिकेटेड पब्लिक हेल्थ प्रोफेसनल with over 25 years of a combined public health care and community engagement program management experience. Currently, Jean serves as a faith and neighborhood community health liaison in Columbus Public Health. Public Health Center for Public Health Innovation, where he leads initiatives to increase life expectancy and improve quality of life of Columbus residents and the faith community. As a member of the community engagement team at the Center of Public Health Innovation, he focuses on engaging stakeholders, building trust, and using data-driven insights to support public health initiatives and optimize resources allocation. In addition to his faith and neighborhood liaison activities, Jean manages Columbus Public Health Connects program, which links over 25 CPS programs and services with the community wellness events and community speakers bureau request. Prior to his current role, Jean directed the Healthy Neighborhood Office, where his team collaborated with neighborhood residents and leaders to establish the Columbus Health Advisory Committee. The CHACs work to address key health issues and concern at the neighborhood level, resulting in public health interventions such as needle syringe drop box program and eventually the Columbus Care Coalition program. Jean holds bachelor's degree in public and administration from Eastern Michigan University. र म उहाँलाई अब अगाडि स्क्रिनमा बोलाउँछु, त्यहाँबाट उहाँसँग हामी बसेर कुराकानी गरौँ। Namaste, Jean.
Bless you, my brother.
How are you doing today?
Blessed, Boone. Glad to be here. Grateful to be here to share this moment with you.
All right. Thank you. First of all, it's so important that we are talking about public health when there is so much of things happening around and many other things, but basically since we are in the business of public health in one way or the other, so there are many things happening in the public health. So in general, I'll ask 2 questions to you first, then I also have some questions from audience, so I'll tell you how we're going to do. It is, I'll be asking the question to you in English, and I am expecting the answer in English only.
Okay.
And I'll generally summarize your answer into Nepali. I'll not go word to word translation. So that way we can you can speak as long as you want, and I'll write. Sometimes I take a note and summarize your answer into Nepali. Okay. All right. Thank you first again for coming out and willing to share your things. So whenever I do these kind of things, I always think that all of us have a very long or short, interesting story in our life. For me, I grew up in Bhutan. Many people here, they don't know, but my actually adulthood, like youth and early childhood and youth was spent in refugee camp in Nepal. I have a lot of experience, which is very unique to many people, right?
Hmm.
So in the same way, we want for this for myself and for my audience, can you share and take us back where you grew up and what your childhood looked like in your maybe early 5, 7, 6 years old memories of you?
Okay. Yes. So thank you, Boone, and thank you for the opportunity to share. I'm born and raised in Columbus, Ohio. Actually, born in Columbus, Ohio. And when I share with a lot of people who are not from Ohio or international, I say I'm raised in a little town east of Columbus called Gahanna, Ohio. And we'll refer to it locally. It is a suburb of Columbus. And was probably about the age of 4. My parents, we lived in the community of Shepherd community, one of the neighborhoods of Columbus. And I overheard my parents, and they were talking about this big monster that was coming in. At least I'm 4 years old now. And I'm hearing that this mom and dad's talking about this monster that's going to come in and gobble up our home as well as the other houses around us. And that monster was called ISIS 70. ISIS 70.
Oh,
Now, that's what I heard. I-670, which is a connector from our airport area or our northeastern suburbs to downtown now. And so my parents moved from Shepherd to Gahanna around 71 era, and I was 4 at the time, and grew up in Gahanna. We were one of the first, well, actually in our subdivision, the first African American family that moved into our subdivision called College Park. It's a subdivision that's next to our 270 now. And I went to the elementary school there and subsequently to graduated from Gahanna Lincoln High School here in the greater Columbus area. So I had a lot of experiences, a lot of great memories too.
great. Thank you. I'll come back. I have a specific question, but let me
Yes.
summarize your points here in Nepali. सो मैले उहाँलाई सोधेको थिएँ, तपाईँ मेरो आफ्नै म खसरनाथ शिविरमा हुँदाखेरि अथवा भुटानमा हुँदाखेरिका मेरा सबैका हाम्रा आफ्ना आफ्ना अनुभव जस्तो मेरा पनि अनुभव छन्। तपाईँले पनि लानुहोस् न तपाईँका बाल्यकालका स्थितिमा कस्तो थियो भन्ने कुरा मैले उहाँलाई सोधेको थिएँ। उहाँले भन्नुहुन्छ म गानामा कोलम्बसमा जन्मेको हो, तर बाहिर हुने मान्छेहरूले भन्नुपर्दा चाहिँ कोलम्बसको छेउको सिटी गाना भन्ने ठाउँमा जन्मेको हो। त्यहाँनिर जन्मिँदाखेरि मेरा प्यारेन्ट्सहरूले आमाबाबाले चाहिँ सानामा हुँदाखेरि एउटा ठुलो मन्स्टर भनेको जमराज भनौँ न, एउटा त्यो आउँदैछ, ठुलो आउँदैछ, त्यसले चाहिँ एउटा हाम्रो सबैको घर खान्छ अरे भन्ने बाबाआमाले कुरा गरेको म सम्झिन्छु। त्यो के रहेछ भन्दाखेरि चाहिँ एउटा रोड बनाउँदै थिए तिनीहरूले यहाँनिर। अब I-670 भनेको रोडको नाम हो। अनि इन्टरसिटी, आई थिङ्क 670 इन्टरसिटी राइट, नट इन्टरस्टेट, इन्टरसिटी बाटो, ठुलो बाटो बनाउँदै, बाटो बनाउँदा त्यो मान्छेहरूका घर भत्काएर त्यहाँबाट बाटो बनाएको थियो र त्यो मसला रोड बाटो खान्छ अरे भन्ने कुरा उहाँहरूले गर्नुहुन्थ्यो। र त्यस पछाडि चाहिँ अब उहाँहरू पढ्दै पढ्दै गानामा सकेर अनि कोलम्बसमा गएर चाहिँ ग्रेजुएसन गर्नुभयो भन्नुभयो। सो लेट्स गो ब्याक टु द I-670.
Uh,
So can you tell, do you have something to add before?
oh no, go
No.
ahead.
Okay, I-670, because I know very little about the story of I-670. I have some other people, some other African American friends was sharing me what did the I-670 and I-70 did to the African American community. Can you tell briefly about what is that? Because many of
Mm,
our viewers have no idea what is that means.
yes. Well, the freeway system or the interstate system that came in, I believe, in the 1950s, began under the Eisenhower administration, really had a devastating impact in a lot of our central cities and predominantly communities of color, because those a lot of the freeway systems divided communities. So when we look at our own community of Columbus, we have 71, that's the north and south freeway, meets I-70, the east and west freeway, huge interstates in this part of the nation. But where they're situated, cut through communities that were previously there. Some historical African American neighborhoods and communities were eliminated. So this happened throughout the country, not only here. And so it divided communities, it divided neighbors, and but the interchange I'm talking about, or the connector, is not specifically one of those, but it was going to have that kind of impact. Come to find out, it swerved southward as opposed to coming through that community, taking out so many homes, as many homes, and that was due to community input and community engagement and advocacy caused that to happen.
Alright, थ्याङ्क यू। मैले उहाँलाई सोधेको थिएँ जुन चाहिँ I-670 भनेको यसले कसरी समाजमा के कस्तो इम्प्याक्ट पार्यो भन्ने कुरा गर्दा चाहिँ अब कस्तो हो भने अब यहाँ अमेरिकामा जुन चाहिँ 1950s मा जब यो ठुलो ठुलो बाटो बनाउने कुराकानी भयो, आइजनहवर जस्तो त्यति बेला राष्ट्रपति यो देशको हुँदाखेरि भने देशभरि जहाँ जहाँ काला जातिका मान्छे बसेका थिए, उनीहरूको बिजनेस थियो, उनीहरूको घर जग्गा जमिन भएको त्यहाँबाट बाटा काटेर लग्यो। त्यसले गर्दाखेरि हजारौँ लाखौँ चाहिँ कालो रङ्ग भएका मान्छेहरूका लागि चाहिँ उनीहरूको परिवार बर्बाद बनाउने, उनीहरूको समाजलाई धुल्याउने, उनीहरूको समाजलाई विभाजन गर्ने खालका काम भएर यसरी धेरैतिर समस्या परेको थियो। तर 670 ले त्यो गरेको चाहिँ होइन, तर त्यसको इम्प्याक्ट पनि देखिन्छ भन्नुहुँदैछ। अलराइट, थ्याङ्क यू Jane for explaining that particular part to us. Now I want to move to the different area. Let us transition to that one. So when I come back to my own personal story, while in the refugee camp, we used to see people in the refugee camp is a whole different story. But when I bring to the context, people were playing soccer. We used to see them as a role model. Wow, how nicely they play the soccer. And I was very little in height at that time. So even touching a volleyball while they were playing used to be a big privilege. Like while they were playing the volleyball, come out and carrying the ball and giving it to the one who are playing, that used to be a big privilege. So forget about going and playing and participating in it at that time, right? So that was my experience, which is very different than your experience. I wanted to see who were the people or role model that influenced you towards the path of public health, or like any kind of influence in your life. Do you want to share that?
Yes, influences. Well, definitely my parents were a huge influence, specifically into service. My father, and I'm grateful to have my parents, and they're with us today. My father just celebrated his 90th birthday, my mother her 85th. Grateful to God for their wisdom, their knowledge, their discipline, their planning, and their purpose and intent for me, and to introduce me to God, first of all. And so, but we'll get to that. But specifically, my father was dedicated service in federal government, and my mother in state government. And so my father worked in implementing a lot of the policies in coming out of the civil rights movement, affirmative action and equal opportunity in the federal government, working to make sure that companies were compliant with fair hiring, fair promotion, and equal opportunity. My mother served at the state auditor's office. And so I learned about the federal and the state. And so specifically, I wanted to go into public administration, and I wanted to serve different than mom and dad. I wanted to serve at a more hands-on level. So I chose local government, and I specifically chose to serve citizens directly. Not to say that federal and the state doesn't, but I have loved the service of serving residents directly, face to face, person to person, and that's been a blessing.
थ्याङ्क यू। मैले उहाँलाई सोधेको थिएँ, मेरो आफ्नो जीवनमा पनि धेरैवटा मान्छेलाई रोल मोडल भन्छन्, कसलाई यसलाई हेरेर काम गर्ने, क्याम्पतिरको घटना है, क्याम्पमा यसो बाहिर भलिबल खेल्दै गर्दा कसैको भलिबल छुन पाउँदा पनि ठुलो भाग्यमानी भएछ हामीलाई लाग्थ्यो। मैले उहाँलाई सोधेँ, तपाईँको जीवनमा त्यस्तो कोही छ रोल मोडल भनेर सोद्धा चाहिँ उहाँ भन्नुहुन्छ, मेरो रोल मोडल भनेको मेरा बाबाआमा नै हुनुहुन्छ। मेरा बाबाआमाले मलाई गडसँग पनि सम्बन्ध गराइदिनु भयो र त्यसमा धेरै भाग्यमानी ठान्छु। मेरा बाबामाप्रति म जहिले जहिले कृतज्ञ हुन्छु, किनभने उहाँहरूका कारणले म यहाँ बोलिरहेको छु, काम गरिरहेको छु। र मेरो बाबा फेडरल सरकारमा काम गर्नुहुन्थ्यो अरे मेरो आमा चाहिँ स्टेट अडिटरको अफिसमा काम गर्नुहुन्थ्यो। त्यस कारणले गर्दाखेरि मैले स्टेटको र फेडरलको कुरा पनि जान्न मौका पाएँ र उहाँसँग मैले बाबाआमादेखि म धेरै जहिले पनि खुसी रहन्छु। उहाँको कारणले गर्दा त्यस्तो हुन्छ। उहाँहरूको जीवनमा उहाँहरूको जीवनको जुन किसिमले जीवनलाई जिउनुहुन्छ, यस्ता विभिन्न कुराले गर्दा चाहिँ मलाई राम्रो भएको छ। मेरो बाबाआमा नै रोल मोडल हुनुहुन्छ भन्नुभएको छ। र थ्याङ्क यू। Let me take few comments here. Indu Bhushan Gautam is telling, good afternoon, sir. Great to hear 25 years of wisdom. Then Indu Bhushan again saying, I don't know if it is the issue of public health. My question, are these myths are true? Some people say that drinking water directly from the tap can create joint problems. Microwave heating food in long-term care create cancer. COVID-19 vaccine may trigger causing cancer, and green grocery stores are the source of Salmonella, etc. Too much preservatives in milk can cause stomach problems. Do you want to share anything in this one?
Well, first of all, I'm not a doctor. I'm not a physician. But you do want to consult with, we have some experts with your public health, your local public health authority, in the environmental health division, in the food, in terms of food, you want to consult their recommendations in terms of the temperature food should be prepared at, the what temperature your freezer should be at. These are public health recommendations and the law that you want to adhere to. Again, I am not a doctor nor a sanitarian, but I can point you in the right direction. I think a lot of your concerns were food related. I thought I heard a COVID-19
Yeah,
question.
COVID-19 vaccine may trigger causing cancer. Yeah, that's what it.
Oh, I cannot speak to that that particular issue. I would consult with your physician first and foremost of all.
All right. Thank you. Now let's go back to my question again. And audience, if you have any question, please feel free to ask your question. If we can, we'll try. If not, then we'll refer you to a different, and we can share the answer in a link afterwards. So thank you for asking question, Indu Bhushanji. He's from Virginia. He is a regular viewer. He always asks questions to all the people who speak with me. So now going back to the other part of the thing. So again, when you came to me in 2015 in our office in Columbus, I was the director of a Bhutanese community of Central Oyo at that time. Bhutanese Nepali community now they changed the name now.
Yeah.
I was the executive director. He came, and at that time I did not know many things that I know today. And you kind of handheld me how to do things. Thank you for doing that at that time. Okay. So that is my lived experience. So I want to ask you a little different question. How did your lived experience shape the way that you approach to the public health? Is there anything as such?
My lived experience. Okay. If I'm understanding you correctly, how I personally, my personal view or worldview, and how my attitude and belief. Is that right?
Yes, and I mean, yeah, particularly, I mean to say that your own experience, how it pushes you to the public health things.
Well, for me, I approach public health in serving people and putting people first. And I've personally done that by respecting and seeking to respect all people, and to be one that seeks to listen before speaking. Often I don't do as much speaking as I'm doing right now. I do more listening. That was from my grandmother. She would tell me, Gene, God gave us 2 ears to listen and one mouth to speak. Don't you think you should be listening twice as much as you speak? And so that has helped me immensely to listen to the needs of our community. Those points or legacy items that you mentioned at the end of my bio that you requested from me came from listening, strictly listening to residents and to neighbors. What are the needs, and how can we go about filling that need? My first day on the job, I'll cut it off here. My manager at the point at that time, she said, Gene, her name was Martha Trout. She said, you want to know the secret to success? I said, yes, yes. Fresh out of college, fresh out of school. And she says, it's simple. Find a need and fill it. And that's what I've sought to do for these now, by God's grace, hopefully next month, 37 years, to
Wow.
seek to find needs and fill them. Uh, in 2 months, I guess in May. So
Alright. मैले उहाँलाई सोधेको थिएँ, अब तपाईँको आफ्नो जीवनको अनुभवबाट चाहिँ पब्लिक हेल्थलाई कसरी हेर्नुहुन्छ भन्दा उहाँ भन्नुहुन्छ, अर्थ सबै कुराभन्दा पनि धेर सुन्ने र कम्ती बोल्ने। त्यसै कारणले भगवानले 2टा कान दिएर एउटा मुख बनाएको छ, किनभने 2 खेप सुन्नु पर्यो र 1 खेप बोल्नु पर्यो भन्ने कुरालाई म मान्छु भन्नुभएको छ। Okay, thank you. That is so important. I think in today's days and time, with the internet in our place, all the time we get information from internet rather than from other people. So many times, I think that is also, we can talk afterwards, what is the impact of this internet on the public health as well. But going into the public health, since you came to our office and yes, you initiated the conversation in the beginning part of 15, 16 at that time.
yeah.
And I can tell up to some extent that you're much passionate about reaching many people in the community from different backgrounds. So what is something that most passionate to you right now in a public health?
Passionate right now about reaching men of color who have had challenges in substance abuse. That's a passion right now in the faith community and in some of our communities of color, in which even though the overdose deaths have declined for the first time, I think in a few years, the numbers in the populations, African American male population, and populations of men of color, I understand, have gone up. And so there's still a need. And in the faith community, in our particular faith, there's stigma and misunderstanding of diagnosis or addiction. And so we're working to address that. It's not a moral failure. It's not a sin. It's a disease that needs to be addressed. And so we're working with houses of worship, specifically right now, congregations, pastors, and congregations that want to support and want to help provide resources to people, their members, who are struggling with addiction. And so that's one of the passions of mine right now.
Thank you. Let me tell that it's very, very, very important for all. हेर्नु दर्शक साथीहरू, तपाईँ कहाँबाट हेर्दै हुनुहुन्छ, तपाईँको आफ्नो सिटी पनि लेखिदिनु होला र सेयर गर्दै जानु होला। उहाँले बहुत महत्त्वपूर्ण कुरा बताउनु भयो हामीलाई यहाँनिर। मैले उहाँलाई सोधेको थिएँ, तपाईँ अहिले कुन कुरामा चाहिँ धेरै ध्यान लगाएर, चित्त लगाएर काम गर्नु प्यासन भनेको धेरै तपाईँलाई मनपर्ने काम छ भन्दाखेरि, उहाँ भन्नुहुन्छ अहिले जो मानिसहरू लागु पदार्थ सेवन गर्छन्, लागु पदार्थ सेवनका कारणले उनीहरूको जीवन बर्बाद भएको छ, ती मान्छेहरूलाई बाटोमा ल्याउन र फेरि जीवनलाई राम्रोसँगले जिउने बनाउनका लागि, सहायता गर्नका लागि मलाई बहुत धेरै मन लाग्छ। त्यसको गर्नका लागि विभिन्न किसिमका पन्थ भए, चर्चहरू र अरू कुनै चर्चका अगुवाहरू जुन पास्टरहरू हुन्छन्, उनीहरूसँग बस्ने, उनीहरूसँग कुराकानी गर्ने र उनीहरूका चर्चमा जाने मान्छेहरू जो जीवन बर्बाद भएका हुन्छन्, उनीहरूलाई सुधारेर फेरि जीवनमा फर्काएर ल्याएर राम्रो मान्छे बनाउनका लागि बहुत धेरै मलाई मनपर्छ र उनीहरूसँग म काम गरिरहेको हुन्छु। र जो मान्छेहरू त्यस्तो जुन आस्थामा कुनै पन्थमा छन्, ती मान्छेहरूलाई उनीहरूको आस्थामा गएर त्यसका अगुवाहरूलाई भनेर बाटोमा फर्काएर ल्याउनका लागि उनीहरूलाई मौका दिनुपर्छ। अब जुन चाहिँ मेरो आस्थामा, मेरो विश्वासका ठाउँमा चाहिँ यसलाई कतिखेप चाहिँ पाप भनेर भन्ने गर्छन्, तर त्यो केही पनि होइन। त्यो मान्छेलाई एउटा किसिमको रोग लागेको, त्यो रोगबाट बचाउनुपर्छ भन्ने कुरा मलाई लाग्छ भन्नुभएको छ। थ्याङ्क यू। I mean, to be like last week in Reynoldsburg alone, one person from my community, he was experiencing homelessness and also going through a lot of issue with the substance, and he was killed in a car accident here in Reynoldsburg. And I realize this is how important your work is. So thank you for doing what you are doing right now.
And Boone, if I could add one item, is this
Please.
passion to show that someone cares, that someone truly cares, because one of the things the internet unfortunately does is a lot of misinformation, and in person we can really see that someone cares, and that's what I'm passionate about, to show the care and concern.
Thank you. So when you talk about that one, I being myself a refugee, and also now that the whole different kind of explanation what a refugee is, what an immigrant is in this current political environment. I will not talk about politics here, but we cannot even get out of politics without talking about it. So what do you see the biggest gap in healthcare access today?
Biggest gap. I still think that the availability of fresh fruits and vegetables, fresh food, is a significant gap. In that a lot of the communities that we serve, there's still, we used to use the term food deserts. I don't know if that's still the proper term, but there are food deserts that need not only information, but we need to continue to provide alternatives, such as community gardens, such as farmers markets, in preparation of food, understanding about the purpose and the importance of fresh fruits and vegetables and healthy food. I think that's a gap. I think the mental health area, mental health, which is kind of tied also to substance abuse, but definitely mental health, taking time for your own mental wellness. I seek to practice what I preach. I take a mental health break. For me, during the healthy months, I go to Franklin Park and take my hour or go for a walk. And I think it's very important to have communication, to talk and express your feelings and your emotions, especially during this time. And I think there's a gap there, that there's lots of people who either don't know how to or don't have access to do just that.
थ्याङ्क यू। मैले उहाँलाई सोधेको थिएँ, जसरी हाम्रो अस्ति समाजमा एकजना भाइको हत्या भयो, जुन चाहिँ भाइको घर थिएन, घरबार विहीन भएर बाहिर बसिरहन्थे, हाम्रै समाजबाट थिए। उनलाई पनि त्यसै विभिन्न किसिमको लागु पदार्थमा त्यो पनि समस्या थियो र उहाँले कुरा गर्दै गर्दा मैले त्यस्तो समस्या छ भन्ने कुरा पनि आयो र त्यसमै कुरा गर्दाखेरि अब कतिजना मान्छेहरूलाई चाहिँ स्वास्थ्य व्यवस्था पनि छ, तर पाउने रोगीहरू पनि बढिरहेका छन् र अहिलेको यहाँको समाजमा सबैभन्दा बेसी समस्या केमा छ त भन्दा उहाँ के भन्नुहुन्छ भने फ्रेस फ्रुट, ताजा सागसब्जी पाउने। यो ताजा सागसब्जी पाउनका लागि फुड डेजर्ट भनेको चाहिँ अब आफ्नो घरदेखि कति पर छ ग्रोसरी स्टोर्स, अनि त्यो टाढा छ भने मान्छे ताजा सागसब्जी ल्याएर नखाने, अर्थकै त्यहीँ यताउता कच्चा कुचो मिलाएर खाने खालको, र यस्तो खालको चाहिँ अब सबै मान्छेकोमा सुविधा छैन। त्यो चाहिँ अलिक धनी मानीले त गर्न सकिहाल्यो, तर गरिब दुखीलाई त्यो पनि ग्याप छ भन्ने कुरा आयो भने त्यसकोसँग जोडिएको अर्को मानसिक स्वास्थ्य। मानसिक स्वास्थ्य बहुत ठुलो कुरा हो। हुन्छ हामीहरू गाउँघरमा पनि मानसिक स्वास्थ्यको लागि हामी त्यति साह्रो ख्याल गर्दैनौँ। उहाँ भन्नुहुन्छ, म जो बोल्छु म त जो भन्छु त म आफू पनि गर्छु भनिसकेपछि म समयसम्म मानसिक स्वास्थ्य, मेरो आफ्नै मानसिक स्वास्थ्य ख्याल गर्नलाई बाहिर जाने, घुम्ने काम पनि गर्छु भने आफूले मानसिक स्वास्थ्य कसरी सुधार्नुपर्छ भन्ने कुरामा पनि म धेरै ध्यान दिइरहेको हुन्छु र हामीले यी विषयमा पनि ख्याल गर्नुपर्छ भन्नुहुँदैछ। र हेर्ने साथीहरू, तपाईँका पनि केही प्रश्न भए राखिदिनु होला है त। नाउ लेट्स कम टु द very important question based on our situation. Our situation in a sense, you being African American, I being immigrant, so refugee, whatever background, some people called white, some black, some brown, whatever it is, right?
Yeah.
So now, my question to you is, how would you describe the current racial climate in the United States from your perspectives? Let me pause there and tell myself again. I am a current city council president in Reynoldsburg.
Mm-hmm.
Even for myself, I doubt myself, and in my wallet all the time I carry my passport, thinking that at any time I could be stopped by the officers. Maybe I have not been done yet. Nobody has done yet, but I read the news. I'm quite vigilant about all those things, right? So can you tell, because this is, for me, is less than 20 years in the United States. I don't know much about the racial history of this country. I have read. Can you share some of the things that, how is the experience that you had and in the past and the current situation? Whatever you're comfortable.
Okay. Well, I'll go back to when we had just moved into that new home in Gahanna in 1971. That was my first experience, and I'll share the story. I didn't know at the time until I learned later, but when we moved in, there was threats to our family, the death threats, and my father was a part also of the sheriff's deputy of the county, and knew some of the law enforcement, and they actually had to patrol our home. But there was actually a dump truck with I think it was black wreaths and tombstones that was sent to our home. My parents tell me later. But what I do know, and what I'm learning and believe, is that there is always hope. When we left to move to our next home, that community gave a huge block party for us during that transition of 8 to 10 years or something like that. But during that time in school, there was, and at my elementary school, it was either the first or one of the first African Americans at my elementary school. And one of the things that would always occur, I would make friends with other kids, other little white children, and but then something would happen when they would go home, and And there might be a day or 2 or 3 days, but they would come back and it would be totally different. And I would say, Chris, John, Eugene, I had another Eugene in our class, what's changed? And I knew something had changed. And what it was at home. What they brought from home or was told at home changed them. But what I could clearly see, though, was the difference between their view, who they were, and what they brought from home. I could see that, though, at first grade. I could see that because of the relationship that we were developing and the change. Uh, so I didn't want to share too much. I think that you got to translate. My
Well,
apologies.
yeah, definitely. I was digesting it. Before I translate, can you tell me? I don't know the story. What's the tombstone? What it has? What is the symbol is? What symbol is
Oh,
that?
yes. There, as I understand it from my parents, the whoever it was, they sent this the truck, and they had um, tombstones. These are in the funeral in the cemeteries. There are tombstones that state put your name when you're born and when you die, and they had our names engraved on
Okay, okay, okay.
these on the
Wow,
tombstones. I'm not sure. I
wow.
think there's at least 2 of them.
ओके लेट मी टेल उहाँलाई मैले सोधिरहेको थिएँ अमेरिकाको अहिलेको वर्तमान अवस्थामा जस्तै मैले उहाँलाई भने जस्तै म यहाँको काउन्सिल प्रेसिडेन्ट हुँदा पनि मलाई आफ्नो पासपोर्ट गोजिया बोकेर हिँड्ने अवस्था छ र म सधैँ बोकेर पनि हिँड्छु किनभने मलाई लाग्छ कुनै टाइममा पनि मलाई उनीहरूले मलाई पक्रिन सक्छन् किनभने मलाई मेरो छाला मिल्दैन मेरो अर्कै देखिन्छ भने जस्तो मलाई लाग्छ भने मैले उहाँलाई सोधेँ तपाईँको विगतको अनुभव के छ तपाईँ एउटा कालो जातिको मान्छे भएकोले गर्दाखेरि तपाईँको अनुभव के छ विगतको र वर्तमानको म भनिदिनुहोस् न भनेर मैले भनिरहेको थिएँ उहाँले भन्नुहुन्छ जस्तै अघि भने जस्तै 1978 द्याट टाइम उहाँले जब उहाँहरूले एउटा नेबरहुडमा घर किनेको बेला त्यहाँनिर आउँदाखेरि उहाँहरूको मान्छे त्यहाँको वरिपरिको छिमेकीहरूले उहाँहरू नबसे हुन्थ्यो भनेर बहुत तङ गरेको र यतिसम्म गरे कि डम्प ट्रक भन्ने जुन मैला फ्याँक्ने गाडीमा चाहिँ त्यो च्यानमा उहाँहरूको नाम लेखेर चाहिँ तेरो च्यान यही छ भनेर लिएर छेउछाउमा घरमा ल्याएर राखिदिएको र दुइटा हाम्रो घरको छेउमा दुइटामा राखिदिएको हाम्रो नाम राखेको थियो भन्ने कुराकानी त्यस्तो पनिसम्म गर्थे त्यतिसम्म हामीलाई घृणा गर्थे त्यो ठाउँमा छेउछाउमा साथसाथै स्कुलमा गएको बेलाखेरि तर समय चेन्ज हुन्छ त्यसको 8-10 वर्ष पछाडि अर्को नेबरहुडमा सर्नु अर्को घर किनेर गरिसके पछाडि त्यो ठाउँका मान्छेले बहुत ठुलो स्वागत गर्ने पार्टी पनि दिए तर त्यो टाइममा स्कुलमा जाँदाखेरि स्कुलमा गएर त्यहाँ सेता रङका मान्छेहरूसँग मैले साथी बनाउँथेँ आफ्नो उमेरका हे क्रिस भनेर पहिलो दिन साथी हुन्थे तर 2-3 दिन पछाडि घरबाट आइसकेपछि बोल्दै नबोल्ने हेर्दै नहेर्ने र विभिन्न किसिमको यस्ता खालका समस्या हुन्थे त्यो चाहिँ के भएको भन्दाखेरि अब पहिले स्कुलमा त राम्रो घरमा त राम्रै थिए आफूसँग बोल्दा स्कुलमा साथीभाइ हुँदा तर उनीहरू घरमा गएर आइसके पछाडि घरका बाबाआमाले के भन्छन् त्यसको परिणाम त्यस्तो खालको हुने गर्थ्यो भनेर उहाँले भन्नुहुन्छ थ्याङ्क यू थ्याङ्क यू सो इम्पोर्टेन्ट
Yeah.
So we are almost half of the time. So
Oh,
keeping that into consideration,
we're just getting started.
how do you care about like you talk a little bit about the mental health, but I wanted to ask you one thing. At that time, I'm not talking about today's thing because when somebody's putting a tombstone in front of your house when you were a little kid, at that time it's a very much frightening and
Mm,
fearful situation. That's why I can imagine. Right? I have a different
mm,
story thing going on. Now,
yeah.
how did you take care of your mental well-being at that time? I think that is
Mm,
a really big. I'm not talking about you as an individual, Gene, but as an entire community also is a thing. The two things. Can you share some of those strategy,
ab-
knowingly or unknowingly employed?
Absolutely. This will take me to another dimension, and that's the dimension of the spirit. And as I mentioned, we would finally get back to God. And because for us, God is the center in our particular faith of our existence. We're physical, we're a spiritual being in a physical shell and in a physical existence right now, but we're past. I say all that to say that our situation, which isn't different than many others. We wouldn't have gotten through without faith in God. And so it is that faith that my parents, and I watched my parents, my mother and father, my grandparents to exhibit this kind of faith under a kind of oppression that fueled my faith. And I've come to develop my own faith in God. So you asked the question, what could get you through? Not your own mind, not your education, not our status or anything, but a faith in God, a trust in God to see us through.
Wow. मैले उहाँलाई सोधेको थिएँ, अब आफू घर किनेर एउटा ठाउँमा जाइन्छ, त्यो घर किनेर त्यहाँ ठाउँमा गएको बित्तिकै चाहिँ त्यहाँको छेउका छिमेकीले चाहिँ तँलाई गाड्ने च्यान यो हो भन्दै बाहिर च्यानमा नाम लेखेर ल्याउँछन् भने त्यो अवस्थामा त्यहाँको समाज उहाँको मानसिक स्वास्थ्यमा कस्तो भयो, त्यो मानसिक स्वास्थ्यलाई कसरी बचाउनु भयो त्यो अवस्थामा भनेर मैले उहाँलाई सोधेको थिएँ। र त्यो व्यक्ति तपाईँ मात्रै नभएर इन्टायर समाजले कसरी बचायो त भन्दा उहाँ भन्नुहुन्छ, त्यो त म अब ठुलो कुरा भयो, भयङ्कर गहिरो कुरा भयो, मेरो अर्को कथा भन्नुपर्ने हुन्छ। तर मलाई लाग्छ मेरो शरीर जो देखिने शरीरदेखि भित्रहरूको स्पिरिटको शरीर पनि हुन्छ। त्यो शरीर भनेको चाहिँ गडसँग सम्बन्ध भएकाले गर्दा मेरो गडको विश्वास भएकाले गर्दाखेरि नि म आध्यात्मिक बाटोपट्टि लागेर नि म त्यति बेला बचेँ, हामी बच्यौँ र किन अन्ततोगत्वा गडकै कारणले हामी बच्नुपर्छ भन्ने कुरा मलाई लाग्छ र त्यसैपट्टि हामी गएर बच्यौँ भन्नुभयो। Thank you so much, because that is very, very, very important all the time for many, many people, right?
Yes.
So here Indu Bhusan is writing another comment. Good answer. Yes, I'll contact concerned authorities. In Virginia, we have the same problem of overuse of drugs and nicotine and tobacco amongst the youth. Yes, I agree about the problem of mental health, and it is really burning issue. Chinese vapes, Indian chewing tobacco are openly smuggled and sold, which need to be completely banned. Is anyone else working on this? That's his question.
Could you repeat that about the banning? I think I got it up to
he's talking about Chinese vapes, Indian chewing tobacco are openly smuggled and sold, which need to be completely banned. Is anyone else working on this?
I do believe our tobacco, we have some tobacco cessation programs that are working on. We do have had a smoking ban in Columbus that was in existence, but I don't think in that specifics of what they're asking about. I would have to check with our smoking cessation programs to see if we do have anything that's working in that specificity.
Yeah, thank you. हेर्ने साथीहरू, तपाईँलाई फेरि म अनुरोध गर्छु, तपाईँका पनि केही क्वेसन छन् पब्लिक हेल्थ सम्बन्धी भने लगाइदिनु होला। देवी दाजुले पिकरिङटनबाट भन्नुहुन्छ दुर्गा नेउला जय होस् भन्नुभयो। अरू साथीहरूले कहाँबाट हेर्दै हुनुहुन्छ तपाईँ सिटी लेख्दै जानु होला र अनि फेरि तपाईँका क्वेसन छ भने राखिदिनु होला। So now let's go to your daily thing. So can you tell us what you do in your daily job here in the Columbus Public Health, because you are liaison and also you work with the neighborhood and faith communities.
Right.
Brian Hall was telling me about you and Brian co-chair some committee there as well, right?
Yes, that's right. That's right. So daily, on a daily basis, oh my goodness. One of the things you mentioned, I'm responsible for coordinating our wellness events for the department. The wellness events, when a public has a wellness event, a health expo that comes up and wants our Columbus Public Health programs. So I do coordinate 25 plus programs that engage the community, and also coordinate our speakers bureau. So when requests come in for speakers, we're scheduling and coordinating those. But then I do provide regular consulting. And so we're consulting from a faith perspective to not only programs within Columbus Public Health, but programs in other city departments and community partners that are looking to get their programs, whether it's a university or another nonprofit that is looking to get a program into a specific community and may need connections with the ministers or the faith community or the neighborhoods in that area. So we're constantly busy providing and seeking to connect. So we do a lot of connecting, such as you do, connecting entities that are trying to get into the community and connect with the community. Then we're seeking to build trust always. During this time, if there's any time that has been a challenge, it's been the erosion of trust. The erosion of trust through the internet, through the misinformation, the misconceptions. I spent a lot of time during COVID in communication, public speaking about COVID and going through the myths and the misconceptions. But that's happening. And so we're trying to build trust on an ongoing basis now.
धन्यवाद, थ्याङ्क यू। मैले उहाँलाई सोधेको थिएँ तपाईँको दैनिक चाहिँ के हुन्छ त काम भन्दाखेरि उहाँ भन्नुहुन्छ कन्टिन्यू 27वटा जस्तो प्रोग्राम छन् पब्लिक हेल्थका, ती प्रोग्रामलाई कोअर्डिनेट गर्ने काम म गर्छु। समग्रमा भन्नुपर्दा उहाँले भन्नुहुन्छ हामीले चाहिँ विश्वास गुमाइसकेका छौँ। इन्टरनेटमा विभिन्न किसिमका कुराहरू आउँछन्, ती कुरा कति सत्य हुन्छन्, कति असत्य हुन्छन् र मान्छेहरूले चाहिँ आफ्नै तरिकाले आफ्नै किसिमले समाचार लिने भएका कारणले गर्दाखेरि सही समाचार दिनका लागि गाह्रो पर्ने भएको कारणले के गर्दा कसरी अरूसँग गएर जोडिने, उनीसँग गएर सम्बन्ध बढाउने, कनेक्सन हुने भन्ने कुरामा हामी धेरै समय बिताउँछौँ। अर्को चाहिँ स्पिकर्स ब्युरो छ। स्पिकर ब्युरोसँग पनि म काम गर्छु र स्पिकर ब्युरो कोही मान्छे बाहिरबाट बोल्ने आयो भने उनीहरूसँग कोअर्डिनेट गर्ने काम पनि म गर्छु भन्नुहुन्छ। थ्याङ्क यू। So can you talk a little bit more about the speaker bureau? What is that?
Yes, there's about 20 plus programs that have regular speakers that will come and speak on a particular topic in public health, such as trauma-informed care through our CARE Coalition, or infant mortality through our Infant Fatality Review Board, or neighborhood social services or environmental health. Any of these topics that the community may request, depending upon availability, we have speakers from Columbus Public Health that can come and speak on those particular topics. So we help to coordinate that in addition to our wellness events. Trying to get connection. It's about connection.
Right. Does the domestic violence come under that?
Domestic violence, you say? Yeah. Yes. Well, within our community violence, we have called the CARE Coalition, and they're addressing trauma-informed care. But I don't think we have a specific program that addresses domestic violence, but we can definitely make referrals for you.
Okay, thank you. मैले उहाँलाई सोधेको थिएँ स्पिकर्स ब्युरो भनेको के हो भनेर, तर यहाँ पब्लिक हेल्थमा मान्छेहरूलाई केही कुनै विषयमा जान्न बुझ्न के गर्न मन छ भने हामीसँग धेरैवटा विषयहरू छन्। त्यसमा चाहिँ हाम्रा कम्युनिटी कोलम्बस पब्लिक हेल्थ एक्सपर्टले गएर बोल्ने गर्छन्। तीमध्येका धेरैवटा कुरामध्येको ट्रमा इन्फर्म केयर भए अरू धेरै कुरामध्येको धेरैवटाहरू हुन्छन्। र त्यसमा मैले सोधेको थिएँ डोमेस्टिक भाइलेन्सलाई घरेलु हिंसा परक कोही छ कि छैन भन्दा त्यो म ठ्याक्कै मैले भन्न सकिनँ, तर यसो भए पनि नभए पनि हामी छैन भने पनि कसैसँग लगेर जोडाइदिन सक्छौँ भन्नुभएको छ। Okay, thank you for that. And also, you are also also part of this one COPLTI and the Toastmaster, right? Can you talk about what is Toastmaster to our audience?
Yes. Well, okay, I'll take Toastmasters then first. Toastmasters is a international educational program that teaches communication, and leadership skills. And often I went into Toastmasters because I had a great fear of public speaking. And it's called glossophobia. And I was working with our community leaders and wanted to express to them, one, my care, and I would always get emotional. I would get too emotional when communicating, and I learned through Toastmasters more how to convey my thoughts publicly. But then I learned also in this journey that we're continuously learning. And what I've learned is that there was a more foundational fear than the fear of public speaking, because we all speak in public, whether we realize it or not. But the more foundational fear for me was the fear of rejection. So it was really, what do I think if I make a mistake while speaking in public? And so the Toastmasters experience gave me, and still gives me, I'm still member, and still gives me opportunity to practice, to be with a group of people who care. That's that old saying, John Maxwell, I agree with him. People don't care how much you know until they know how much you care about them. And that is, it allows you to fall and fail your way to success, because we're all going to fall. We're all going to fall short, but it's what you do once you fall, and the people who are surrounding you to help you get up when you fall. Does that make sense?
एब्सोल्युटली, थ्याङ्क यू। उहाँ अर्को दुईवटा प्रोग्राममा हुन्छ, सिओपिएलटिआईको बारेमा भन्नुभएन, अहिलेसम्म भन्नुहुन्छ होला, अनि अर्को टोस्ट मास्टरमा हुनुहुन्छ। टोस्ट मास्टर भनेको के हो भनेर मैले सोधिरहेको थिएँ। उहाँ टोस्ट मास्टर भनेको चाहिँ यो अन्तर्राष्ट्रिय विवक्षा भन्छ नि, मान्छेलाई बोल्नको लागि आफ्नो आँट विकास गर्ने खालको एउटा व्यवस्था हो। त्यसमा चाहिँ मान्छेहरू आउने, बाहिर आएर बोल्ने, गफ गर्ने, कुराकानी हुन्छ। त्यहाँ चाहिँ धेरै मान्छे, मेरो आफ्नै व्यक्तिगत कुरा गर्नुपर्दा म मान्छेसँग बोल्न डराउँदै बाहिर गएर कहीँ बोल्नु पर्दाखेरि, तर मेरो आफ्नै कारण चाहिँ के भने, म बाहिर म केही चाल पाउँदाखेरि आफ्नै मेरो अरूकाले मलाई के भन्छन् होला, मैले बिगारेँ भने भन्ने मेरो डर रहेछ। र टोस्ट मास्टरमा गएपछि मान्छेहरूका माझमा बस्ने, जो आफ्नो ख्याल गर्ने मान्छे हुन्छ, ती मान्छेहरूसँग बसेर कुराकानी गरिसके पछाडि आफूलाई बोल्न आँट आउँछ। अनि के भन्छ, जीवनमा केही गर्दाखेरि लडिन्छ, लडेपछि उठ्नुपर्छ। र त्यो टोस्ट मास्टरले चाहिँ हो त्यो मौका दिन्छ मान्छेलाई, लड्ने पनि मौका दिन्छ, उठ्ने पनि मौका दिन्छ, र कसरी चाहिँ आफ्नो कन्फिडेन्स बढाउने भन्ने कुरा टोस्ट मास्टरबाट हुन्छ, र त्यसमा भाग लिन्छु भनेर भन्नुभएको छ। थ्याङ्क यू। क्यान यू अल्सो टक लिटल बिट अबाउट सिओपिएलटिआई?
Yes, thank you. That was my next point. And COPLTI allows me, it's a organization, a national organization that helps parents to become advocates for their children, and become better advocates, parenting advocates. And so I have had the fortunate opportunity, the honor to teach a couple modules during the curriculum of our COPLTI, that's Central Ohio Parent Leadership Training Institute, to teach on voice and communication. So what I've learned and learning from Toastmasters and public speaking, sought to deposit into the cohorts. I think we're up to 5 or cohort 6 now. Now it's also in the language of Spanish, and to teach public speaking with conviction and confidence, and listening, and being able to transition from those who may be fearful or those who may be polished in communication, to go to new levels so that they can advocate for their children, and advocate anywhere, state house, to the judges, to the media, wherever.
राइट थ्याङ्क यू मैले उहाँलाई सोधेको थिएँ यो COPLTI भनेको चाहिँ के हो भनेर उहाँको बारेमा भनिदिनुहोस् भनेर थिएँ सेन्ट्रल ओहायो प्यारेन्ट लिडरसिप ट्रेनिङ इन्स्टिट्युट इट्स माउथफुल त्यसको बारेमा उहाँले भन्नुभएछ यहाँ चाहिँ मैले आएर यो प्यारेन्ट्सले चाहिँ आफूले कसरी आफ्नो नानीहरूका लागि चाहिँ वकालत गर्ने भन्ने विषयको तालिम दिने व्यवस्था हो त्यसमा मैले गएर दुईवटा तिनवटा कक्षामा बसेर पढाउने व्यवस्था पनि पाएको थिएँ त्यसमा चाहिँ प्यारेन्ट्सहरूले गएर मैले जुन चाहिँ टोस्ट मास्टरमा सिकेको ज्ञान थियो त्यो ज्ञानलाई लगेर त्यहाँ राख्ने व्यवस्था पनि भयो मौका पनि पाएँ र प्यारेन्ट्सहरूलाई त सिकाउन पाएँ र मैले सिकाएर म बहुत भाग्यशाली ठान्छु भन्नुभएको छ Now, maybe our last question. If the audience have any questions, please do and share this video, and also please do subscribe in a YouTube. That will be very helpful for me. So I want to ask one question regarding the current politics, and with that we have to end our session also. What advice would you give to the young immigrants and also the African American people, those who are interested in public health?
The advice I would give to the immigrants and those new into public health, did you say?
Yeah, those who are interested to public health, young people.
Interested in public, yes. Come in with an open mind and come in looking for opportunities to meet needs. There are a vast amount of need that's in public health. And I would say, just as when I came into public health, listening for need, be creative and be innovative. Sky's the limit with what is possible. We need your creative ideas. We need your innovation. We need your thinking out the box in new dimensions and new levels of consciousness. Because the problem, I think it was Einstein that said the problems that we have won't be solved at this level of thinking. You got to go to another level of thinking. And so that's where you come in with the fresh ideas. Unfortunately, we get into those of us who have been in the 25 years, that's great on one side with history, wisdom, and some knowledge. But then you get into ruts. We all do. We all do. And I'm constantly asking myself, the American futurist who wrote the book Future Shock, Alvin Toffler. And I have this quote on my wall. It just simply says, the illiterate of the 21st century will not be those who cannot read or write, but those who cannot learn, unlearn, and relearn.
Wow.
So I'm constantly asking, Gene, what did you learn new today? What did you unlearn today? And what are you relearning? A lot of it for me has to do with this little thing and the thing we're going through, technology. But there's things that we're all learning, unlearning, hopefully, and relearning. And so that's what I would charge the immigrant, those new to public health, keep learning. Another thing I would add, the last thing is I learned this from a speaker. He was a salesman and he was an educator, Charlie Tremendous Jones. He said, always put an ing on your verbs, we are learning, we are growing, we are discovering, we are becoming. Why? Because no one has learned the most, grown the most, discovered the most, or become the most. We are all on a continuum. We're all on a path. And so I consciously try to keep the INGs. And that's also put me in an attitude of growth to keep those INGs. It's a little thing, but it keeps you growing.
Wow. Indubhusan Gautam is telling, I learned a lot from you. Thank you. So to conclude, concluding sentence is that I am learning, I am growing, and I am seeking, let's say that one, right?
Yes.
त उहाँले भन्नुहुँदैछ अब अन्ततोगतमा मैले भन्नुपर्ने चाहिँ जो पब्लिक हेल्थमा आउन चाहनुहुन्छ मसिना भाइ बहिनीहरू भने तपाईँहरू दिमाग खुला राखेर आउने, मलाई के गर्नु छ, म सिक्दैछु, म जान्दैछु, म बढ्दैछु भन्ने, म जीवन मैले आज के सिकेँ, मैले के चाहिँ बिर्सिनुपर्ने कुरा बिर्सेँ, अनलर्न गरेँ र अब के कुरा सिक्दैछु भन्ने कुरा ध्यान राखेर आउनुभयो भने तपाईँ सफल हुन सक्नुहुन्छ भन्नुभएको छ. With that said, I would like to say thank you for coming and finding the time. Thank you so much.
Thank you, Bowen. Honor has been all mine.